I tend to get a lot of mid and low back pain.
Okay.
I do a lot of Taekwondo and I get hip pain. So whatever you think. So can you tell me, like, why do you adjust people? What does an adjustment do? Tell me a little bit about an adjustment.
Sure. Yeah. The purpose of doing the adjustments is to improve mobility and alignment of the joints, primarily of like the spine and the neck, as well as the hips and pelvis. Just that, doing it in and of itself tends to be helpful for reducing pain and improving like flexibility, mobility, etc. That may get compromised over time by doing repetitive activities such as what you described.
Awesome.
The other thing too is a lot of times that may be one thing that works fairly well with patients, but a lot of times there's other muscular components that get wound up. So sometimes doing massage work or other soft tissue work or cupping is another, manual therapy technique that can be utilized to help loosen up the overlapping muscles. That also help control the joints. So doing it in a combination together allows the treatment to improve the patient and help maintain the treatment to help make it last longer, essentially. So we're going to do both of those today. I guess I'll start by doing the adjustment and then we'll do the cupping.
Great. What do I do?
Just go ahead and lay on your back. You can relax.
Okay.
Stay where you're at. I'm going to have you a little bit closer. Hang in there. Good. All right. Nice and easy. And relax.
Oh, that was, I could hear that.
All right. And then now.
So why does it make a sound when you adjust me? Am I breaking?
Yeah, no. Typically, the sound of that audible pop that you'll hear, it's basically just a pressure release that's taking place. If the joints get stuck or out of alignment or the overlapping muscles are too tight and it's restricting joint mobility, pressure builds up inside the spine. So it's not causing any damage. It's actually providing relief. And it's just a side effect of doing the adjustment in and of itself. But yeah, there's no damage or irritation that's typically associated with the noise.
Not breaking my spine like some people worry about.
No, not at all. Good. So, and there's various techniques for adjusting. Some people might be low force techniques. Some may be a little bit more aggressive. It depends on the patient presentation and what their pain tolerance levels are. So typically with the cupping, you basically use these mechanical devices. It's like a suction device, and we're going to go run it over a couple of different, like some of the tight spots that you have, basically with low back and mid back pain, besides having alignment or joint compression issues, which you just worked on by doing the adjustments. Some of the spinal muscles tend to get overworked, particularly with repetitive activities like you described, like Taekwondo, running, jumping, lifting, etc. So you can do all that. I don't blame you. So you put the suction cup on. There's a couple different techniques with that too that can be done. This particular cup, the nice thing with the plastic cups, I can control the amount of suction that takes place, and depending on the size of the patient, the amount of spasms or the tissue that we're working with, I may change the amount of suction that we're going to utilize with it. So that's why I like to use these particular instruments sometimes over other ones. But once the cups are on, basically we just leave them on, which is great. So the patient doesn't have to move. You don't have to do anything. I don't manipulate the cups or anything like that. We'll just place them in the correct areas where there's either inflammation and swelling or where the muscles are too tight, and then we let the suction cups help basically break up and release some of the muscle tension and release some of the pressure. So, and while this is on, you may actually feel a little bit of tension, but once we pop these off and you get up and you move around, you'll actually notice a difference right away.
Feels really good.
So let's pop one more up a little bit higher. Get this guy on, and we'll get this one on here. And we'll bring this guy back down so you don't get cold. And right now you can just kind of hang tight and relax.
How long do you leave those on?
Yeah, great question. So the cupping depends on kind of what's going on with the patients. 10 to 15 minutes is typically what I'll initially start with. When I'm doing the cupping, sometimes you may leave them on a little bit longer, sometimes a little bit less, but 10 to 15 minutes is approximately about right, somewhere along those lines. And typically what's happening when you're doing the cupping, it's actually lifting up the skin and the fascia plane or the soft tissue plane underneath the skin, between the skin and the muscle. It's kind of opening that up and breaking up some adhesions underneath there. So there's less friction buildup when you're moving. The other thing that's happening when you look at that, the muscles that run up the spine, for example, there's a thickness that is there, and when you do the cupping, it's almost kind of decompressing the thickness of the muscle tissue that's running up the back. So as opposed to like a traction device that may be vertically decompressing somebody, this is actually decompressing somebody from a depth standpoint, which helps it's a different way and a different angle to help loosen up soft tissue in the muscles. So it's pretty cool. One of the few side effects that people experience with the cupping, though, is sometimes there can be some marking or some bruising superficially in the skin. The cupping can create a little bit of a histamine response inside the skin. It's not an allergic reaction, just a natural response to having the cupping instrument on. Over the next couple of days, the little markings will go away. If you ever saw gymnasts or swimmers, one of the therapies they use for chronic shoulder and neck problems is they actually will do the cupping therapy, or they'll have somebody, a trainer or a therapist, do it for them as a way to help loosen up the muscle tissue again. It's the same principle, essentially. We're just doing it in a different area. And the marking will heal up in a couple of days, and then depending on how the patient responds, it's something that you can do again in some of the other overlapping areas and go from there. So, and you may increase or decrease the length of time. So, how's it feel, Kim? How you doing?
Great.
Yeah, you look relaxed.
I am.
You look like you're just hanging out.
I am.
We're good. You about ready to take a nap?
I would love to take a nap. So what are some conditions that cupping helps with?
Sure. Well, obviously the ones that you mentioned right away are some of the first ones. Low back pain, hip pain. And a lot of times those are overlap together. Neck and shoulder pain would be some of the other simple, ones that you can utilize the cupping for. And you could even get the cupping up. There's a couple spots you might want to be sensitive around the neck, along the sides of the neck, around like the scalenes and where the nerve roots exit out. But you can get the cupping even up onto the nape of the neck muscles. I've done that several times using smaller cupping devices. It works fairly well. Neck pain, some of the other locations you might work is the upper trapezius muscles, as well as sometimes around the shoulder joints. Shoulder joint, rotator cuff tendonitis type stuff works extremely well. In fact, I actually think I had somebody else I was doing the cupping for, your dad, doing the cupping therapy for actually earlier. Tends to work well, loosens up the muscle tension around the ball and socket joint, and helps improve just range of motion mobility. The muscles don't have to work as hard, or there's less restriction. Typically, the range of motion flexibility starts to come back. The muscles don't have to work as hard. So that works well. A lot of times, too, with shoulder joint issues, you'll actually find thoracic problems that are going on, whether they have thoracic pain or not. If the middle of the back is compressed and it's not moving properly, it will compromise scapular movement, and it also just trashes the AC joint. So a lot of times you can do cupping for shoulder stuff, but I'll also include upper back and neck locations as well. So neck and upper back, shoulder joint, hip and low back are some of the typical conditions, injuries or complaint areas that you utilize cupping for.
Like frozen shoulder.
Absolutely. That's a great one that you could use it for. Frozen shoulder, you want to promote and get blood flow in there. You can do ultrasound technique with that. And then you can do cupping in and around the areas of the shoulder joint, and then doing some type of soft tissue mobilization, stretching, things like that. Frozen shoulder, it works fairly well for it, but frozen shoulder is a very chronic condition, so you need to work at that. The person's got to be consistent coming in. But the cupping may be one of the important techniques that you can use for that. Absolutely. So yeah, so those are a few. Hopefully that answers the question for you. Makes sense, right?
Absolutely.
Awesome. So let's get these guys off, and then we'll let you come up. We'll see how we're doing. All right. And with you got a couple spots there. They're a little bit dark. But like I said, you might have a little bit of some superficial bruising there over the next day or two, but other than that, everything should feel good.
That does feel good.
Yeah, probably feels much better too. During it feels good, and then after you pop them off, it also feels usually pretty good. All right, there you go. Take your time. Be careful coming up, and we'll check it. Okay, so we talked about doing some cupping therapy for some of the low back and hip and joint problems, which is as a result of like repetitive activities, athletic, But with that being said,
I had a knee injury.
Right. Well, and a lot of times with hip and low back stuff, it also translates down to becoming knee problems. And in your case, it wasn't exactly a knee joint issue. You're starting to have some hamstring tension issues.
Yeah, when I broke my foot,
right.
And my whole knee was all problematic.
So as we talk about that, whether somebody has a chronic hip issue that's going on and that's affecting things lower down on the kinetic chain, or something lower down, like a foot issue that's affecting gait pattern and weight distribution, that might start causing other problems higher up, like your knee, for example. Weight distribution changes, people get patellar tendonitis issues, things like that. Whether they're actively overusing it from like an exercise or not, some of these things might develop as just a direct consequence of a previous injury that hasn't completely healed yet. So we can do a little bit of work on the knee. Doing some ultrasound's perfectly fine. Joint issues for ultrasound can be good. Ultrasound basically works, but it's actually sound waves that actually cause a heating to take place in the tissue and promote circulation. So people who have a chronic tendonitis, you want fresh blood flow to go into those areas because it brings oxygen and nutrition in and washes out the old inflammation and pulls out the lactic acid, pulls out the carbon dioxide, etc., and allows the tissue to heal and kind of calm down. So the ultrasound is great. The way that the instrument also works mechanically, not just the sound wave, but just the mechanical device in and of itself, works good so you can navigate and work around bony joint areas just in and of itself. So the knee is a perfect thing we can do. We'll do a demonstration of that right now. Ultrasound is very simple to do. It's like 3 to 5 minutes. So, and how long has this been bothering you for?
2 weeks.
2 weeks. All right. Well, then we're going to consider this to be acute. Tendon ligament superficial. We're going to go here. I'm going to get this guy cranked up.
Will this hurt? Do I feel any shocking
No.
sensations?
The interesting thing is, no, you probably won't feel too much of a stimulation with this at all. And in many instances, you won't even feel anything.
Okay.
Every once in a while, people might say that they feel a little bit of a warmth that's taking place there. However, you know, for the most part, people don't feel anything when they're on the ultrasound, and sometimes they ask you if it's even working. But yes, typically the ultrasound, you won't.
Doctor, is this even working?
It is working. It is working. The equipment is on. You just relax.
You love having a smart ass.
You just relax and let the treatment do its job. So we'll make sure that we get you the right treatment and we do it in the right areas, and you just allow that to work and give yourself a few days, and you'll notice that you'll start feeling a little bit better.
Got it.
So when you do the ultrasound, one of the techniques that you have to keep, so there's a lot of physical therapy applications or different areas or body parts you can use this for. So in your particular case, we're going to work the knee. So you just kind of hang out and relax, let it do its thing. All right.
What does it feel like?
Just cool. Like, that doesn't hurt or anything. It just feels very much just like that rubbing on me.
Yeah. So the instrument pro was metal, first of all, and second of all, you're probably feeling just the cool ultrasound gel itself, kind of just getting massaged superficially on the skin. So yeah, you don't really feel too much other than that, really.
Yeah,
that's about it.
Tool.
So, yep.
Since we're doing demonstrations for the participants after this, you could try it.
Thank you.
All right. So we'll kind of work this. I'm going to bring this down. We'll kind of get the other part of this here. Same thing, same technique.
So what made you decide to become a chiropractor?
I got hurt.
What'd you do?
I got hurt in sports. So you end up in an office and you kind of get exposed to a little bit of that realm, and you know, you kind of, the person kind of befriends you a little bit, kind of becomes a little bit of a mentor, and before you know it, you know, you start thinking that might be one of the things on the list. So, you know, you also run with somebody who's got really good communication skills, also really successful, and you kind of see that and you're kind of a little bit further interested in it. And, you know, so that kind of was the initial part. But, you know, being an athlete and then being into, you know, physical fitness and things like that, and wanting to also kind of go into healthcare or doing chiropractic or physical therapy, possibly medical school, it kind of made sense that I was going to end up in one of those disciplines somewhere, even though that's fairly broad. There's a lot of different ways you're going to go with that. But yeah, you know, as a result of just a musculoskeletal injury, in fact, it was neck and back stuff, you know, and I was typically doing adjustments, stimulation therapy, even some cupping was kind of the type of treatment that I was doing, you know, which is some of the stuff that we currently do now for our patients. Yeah. So yeah, pretty cool.
That's so cool.
It's very cool. So, and that's something that's always kind of stuck with me. And, you know, fortunately to be out working for a long period of time and you still enjoy what you do, you know that you picked the right thing. So the interesting thing too is the general public, it's great that we're showing some of these different, you know, therapy modalities as well as different areas that we work on. As a chiropractic physician, you know, a lot of people know us to treat neck and back stuff, but the reality of it is we're more of doctors of all musculoskeletal, you know, accidents and injuries. I mean, there's things that need to get referred out to either pain doc or to an orthopedic doctor if there's a positive MRI findings or something like that, and there's a tear, it may need surgery, but pre and post surgical rehabilitation for extremity issues, whether that's a rotator cuff issue or a chronic knee problem or something like that, or a meniscus tear, we do all of that. We do all of that, you know, in a very similar sense as a PT or physical therapist would do. So it's part of our education, part of our training, and it's part of what we do every day. It's not just working on neck and back patients. So this is a great example of that. So, all right. So I'm going to pop this off, and I'm going to go ahead and get this guy cleaned up for you. It can be placed depending on the area that we're working on. You can use 2 pads or 4 pads. Today I'm going to start by using 2 pads, and basically what I'm going to do is I'm just going to kind of encompass the knee joint in and of itself here. All right. The electrode pads stick on there, and yes, it's an electric stimulation therapy, as opposed to the ultrasound where you don't really feel much other than the cold gel and the instrument or the probe in and of itself. Once we turn this up, you're going to actually feel the stimulation there.
Keep it low.
Yeah, and electric stim therapy is great. You can use it for joints. You can use it for broader areas for muscle pain, muscle spasms, and you can use it for neck or back, shoulder, knee joint, etc. So there's a lot of applications for electric stimulation therapy, and a lot of patients notice you set it up right, you get the setting right, and then it's on for 10, 15 minutes. It's actually very relaxing. A lot of patients find it helps kind of calm the muscle tone down. They feel like they're looser after they get done with the stim. They feel lighter, or the muscle tone it's not as tense. So it's a great thing for, relaxing tight muscles as well as reducing inflammation and swelling, which is what we're going to do for you. So with that being said, I'm going to turn this guy up. Let me get it set up right. And we'll get you in the first one here, like your first 2, 1 and 2. And let me get this guy started here. All right. So you're going to, and with the feeling, you're going to feel like almost like a tingly massage type of a sensation. And when you want this on, it's strong but comfortable. So you're going to let me know. All right.
Okay, I get. Good.
Okay, you feel it jumped up pretty quick on you, huh? I don't have it up very high, just so you know.
I feel right here and here.
Beautiful. All right. So, and if it's up too high, it actually might cause a twitching response. All right, just as something so that everybody's aware of it. It's not going to hurt you, but at the same time, it's not going to allow you to relax as much. So you want it just below that threshold point.
It's a good threshold. Right
Perfect.
Now.
Well, you're just going to relax here. You got some time to hang out and just let it do its thing. Okay.
Yeah. Awesome.
Very good.
Okay, now we can stop it.
Yeah.
Is there a number, or is it just kind of?
No, it's based on. I mean, that thing was on 8. Like I can crank that thing up.
So there is
40.
a number.
Oh, yeah. Well, pain intensity. I mean, a intensity of that when I'm cranking it up. Yeah, like how strong is the electrode intensity? Yeah, and it's based on patient tolerance and feel and what's going on. Like if that. Anyways, we just finished through the stem. It just finished running through there, so it was comfortable. I had it on there, right? Yep. So I'm going to take the lead channels off, and then we'll let.
Hurt? Is it like real adhesive?
No, you shouldn't have any problems with it. You're prepared.
I'm
Some of my male patients with the hair may be a problem pulling off the electrode. With you, I don't think they're going to have any problem at all. So anyways, I'm going to take these guys off gently. You shouldn't have any problem with that. Typically when you do the electrode stuff for sanitary reasons, typically I just replace them. We'll discard them and then we put new ones on every single time.
We are a very clean clinic.
It's very, very simple, very easy to do. It's very cost effective for the office to do it that way too for patients. The one thing that you need to keep in mind with that is when you do the electric stimulation therapy, why it's important for you guys to let us know how you're doing. If I can't see any type of muscle twitching and that thing's up too high, the electric intensity through there, it does generate heat in the pads. So you have to be mindful of that because you don't want it to irritate the skin. Yes. So that's one thing to keep in consideration when you're doing the stim. We had yours on extremely low. So you shouldn't have any problem with that. And just removing them shouldn't be uncomfortable by any means. So
nope. Piece of cake.
Good. So yeah. So that's doing the electric stim therapy. Simple to do, fairly easy, very comfortable. Like I said, you can do it for, some of the knee tendonitis stuff that you described earlier, or you can use it for neck and back pain, muscle spasms, things like that.
And those who decided to watch, if you have any questions about chiropractic care, cupping, stim, ultrasound, please leave your comments below. If you have any ideas for future health talks, please leave your comments below. And remember to like us, subscribe, follow us, and thank you so much.